First Baptist Church in Center, it's time for the Coffee Shop Café, brought to you by Memorial Hospital of Center.
Well, it's a great, great morning this morning in Center when you tune in the Coffee Shop Café. There'll be news around the town, we won't tell it with a frown, cause our hosts are always smiling, saying, how do you do? Oh, it's a great, great morning this morning in Center when you tune in the Coffee Shop Café. Won't you sit right down and join us? The coffee's always on us at the Coffee Shop Café.
The views and opinions of our guests today are not necessarily those of First Baptist Church, KLCR Radio, or our sponsors. And now here's your host and hostess, Wayne Christian and Shirley Schaffner.
We're glad you dropped by for the coffee shop. We have some very special guests with us this morning, but before we get started, let's have a word from our sponsor, Memorial Hospital.
It's good to know that someone's there, a special friend with tender love and care.
Memorial Hospital, someone that really cares. Neighbors helping neighbors. When you're required admittance to a hospital, choose a hometown Memorial Hospital. Dependable, efficient, with personal attention.
Good to know that someone's there.
Our professional, efficient, friendly hospital staff cares about you. Our patients are special to our administration, management, doctors, nurses, and staff at Memorial Hospital. With emergency care, intensive care, Medicare and Medicaid approved. Neighbors helping neighbors. Memorial Hospital. We're there, and we care.
It's good to know that someone's there.
We're glad you're here with us this morning, and as you may have already recognized, this is not Wayne. Wayne's going to be gone another Sunday or so, and Buster's filling in. Thank you for coming by.
Well, thank you for letting me come by.
We appreciate you filling in for us.
We should feel sorry for Wayne. Is he in Hawaii or is he
One of those bad places like that.
New Zealand or roughing it somewhere?
Really having a rough time, yeah. I'm sure he's thinking about us this morning in the coffee shop.
I'm certain he is. If his clock is running at the right rate, he's maybe asleep this morning.
That's true, it may be different. But we're very excited about our program that you've gotten together for us this morning. And I understand there was a question that you wanted to start the show with this morning. Is that correct, or have you forgotten the question?
Yes, no, I haven't forgotten the question. I wanted to ask Larry in the control room if you will ask Marilyn about making coffee. You put more water in than you do coffee, and she'll explain that to you. That was my question.
That was your question? I thought it had something to do with... We're going to get real personal this morning. He may come in here and cut us off. And if we go off, you'll know what happened.
No, I did have a serious question. We have some health professionals with us this morning. We have a health professional, Lyndon Jobe, who is...
that was a title that I didn't know he had. I just thought he was principal. Just principal.
One more hat to wear. And he is principal, of course, at the junior high school. And the show is about health professionals, and we'll tell you why he's here in a second. And we have Dr. Jane Todd, who is, of course, a health professional. She's a local surgeon and wears a lot of hats. We appreciate her so much. And we have Mary McSwain, who has a hat or two of her own and takes care of our public health clinic here in Center. But the question I had, Shirley, was, is money a problem concerning health care? And I'm sorry that's so broad. Health care providers, professionals, but is money a problem? Mary, it's your clinic. Is it a problem?
It is, in many ways. So many of the clients that could have these services available do not realize that they are. A lot of people think, well, I work, I have a job, I can't come to the, quote, free clinic, which is no longer free. We are on a copay service. Several years ago, all the state agencies did have a tremendous cut in funds. Ours have been cut too, is why we went on a copay. We do not have as broad range of services as we did have. For instance, we no longer do yearly exams on women who don't need a method of birth control. This was cut several years ago. Things are very tight, but we are tightening the belt, so to speak, and furnishing the services to as many as possible.
Has the copay been successful? What is it? Do they pay according to their income or?
According to their income, and there is a Category A that is not assessed any pay. We do ask for small donation from everyone, but if they're not able to pay, we're not refusing services to anyone. They're now asking for the first time that we encourage those who are in the category C, the full pay category, go to their private physician if possible. But there again, you can fall in that category and not have insurance and cannot obtain care anywhere else, and we're still able to see them. Particularly for immunizations. The local physicians are not carrying immunizations anymore because of the high cost of them. The immunizations have a short shelf life. And they can't afford to pay $20 a dose for DPT and have 10 out of a 15-dose vial be expired.
So to get immunizations locally, you're the only one that's providing this service?
Mostly. There are a few private doctors that carry just a few, but very few. The pediatricians and Nacogdoches all have the public health clinics posted in their office in the days of our clinics, and they're not doing any.
Well, let's find out where the clinic is. I may want to come down for my DPT shot.
Okay, we're 708 Southview Circle. It's Highway 96 South, across from the bus station.
I pass there quite often, and on those immunization days, you're very busy. How many do you usually see on an average day?
75 to 100 on the 3 Tuesday mornings a month. It's the second, third, and fourth Tuesday mornings.
What's the typical thing you see people for, these 75 or 80 people that you see? Mostly children, or?
Mostly children. Unfortunately, June, July, and August, it's the 5-year-old that's got to get caught up to get to school. We're talking about caught up a child that's never had an immunization.
Oh, really?
Many in the summer months. It gets a little wild, to say the least.
That's when the school system comes into play. They have to have so many to be able to start the school.
Right.
You know, I bet if she told the truth this morning, she'd say there's 1 or 2 that comes down on the first day of school.
After the first day of school.
Oh, after the first day of school.
Very many. Yeah.
Goodness.
Well, you know what happened here, because it seems like that just a few years ago, we used to have a horrible word in our house called polio, and so there were words that floated around in the rooms that were just horrible words. And when vaccines came out and immunizations came out, we were thrilled to be able to avoid these crippling and debilitating diseases. What has happened since 1950 and 1989?
Complacency. The young parents did not live through that era. The young parents never knew anyone who had polio or who was mentally retarded or deaf or blind from measles, meningitis. The young teenage mothers and mothers in their 20s never lived through this era. They don't realize the dangers.
That are still there because we still have the
diseases, yes.
So we're really talking about some educational efforts that are needed here.
True.
Also. I was concerned when Shirley called about this program, because you really got this program this morning, Shirley, and thank you for it. I was concerned about this measles thing. And I went to the dictionary this morning and looked it up to see what an epidemic was. That's what the word is being bannered around. And it turns out just to be a widespread disease in a locality. Do we have a measles epidemic, Dr. Todd, in Louisiana?
Well, I just know what the news reports say, and they do call it an epidemic. But Mary has kept in touch with the Texas Health Department.
We do not have a measles epidemic in our Deep East Texas area. There's been 1 reported case in the 3 counties that I cover, which is St. Augustine, Sabine, and Shelby County. 1 case in Tennehaw, an unimmunized child. We don't have the titer back yet that it's definite measles, but of course the symptoms do point that way. But we've been very, very fortunate. One of the reasons being is that our schools are a little bit tighter than a lot of schools in Louisiana are about letting them in. And our local doctors that cover for our immunization clinics, we do not immunize without a doctor on call in case we have a reaction. Our doctors want, when we get a child there that's never had any immunization, everything that they can have. You may give them 4 shots at first day, but they want the maximum immunization into them. We may give them a DPT, their polio, their measles, mumps, rubella, their Haemophilus influenza, and their TB test all at once.
You know, the other interesting thing is that my children may have a puncture wound in the summertime, and I explain to them, you're going to get lockjaw and you're going to die if we don't get a tetanus shot. And they say, so be it. I'll die. I'm not going to get a shot. Surely there's going to be a better way to give these immunizations one day in the future so the children don't dread it so much.
Dr. Todd?
I know there's Star Wars technology somewhere in the future, but we haven't read anything about it yet.
Still in the future. It's still got to get under that skin some way or another, huh?
Well, regarding the educational effort, we did invite health professional Lyndon Jobe to come with us this morning because we have made a decision to spread the good news down on the junior high level regarding health issues. And you made a big step this year. This year?
Started last year.
Started last year. A big step to dispense health information. Is that how you describe the program?
Well, we call it health counseling, or just another way to get to students some information. Our primary objective here is to give a student an opportunity to talk to someone besides a teacher, counselor, principal, whoever, about a health problem that he might have.
Well, I can't understand why you wouldn't want the kids to talk to the teachers, because my first grade teacher told me babies were brought with a stork. And I learned that lesson early because she never lied.
Right.
So I don't see any real reason to have any other information dispensed.
Well, our teachers certainly, I think, are well informed, but students have a tendency to look at us as teachers, educators, as opposed to health information people. They're not as confident with coming to us with a problem that they might have. Certainly, we hold these kids' confidence a lot more than they probably believe that we do. But if they have more confidence in this lady, then power to them. Let's give them the opportunity to talk to somebody that they have some confidence in and not afraid to share these things with.
Are you having a good response from the letters that you've sent out? And word of explanation, Mary had a form that she'd have to sign for the children to participate in, and you sent out an explanation letter explaining what would be covered at the school only.
Right. The general consent form that the state must send out is very, very broad. It covers a lot of things that we have no intention of trying to cover at the school. Generally, we're trying to educate our children, give them an opportunity for counseling, and if we run into a problem, then of course we would contact the parent and get permission to go any further with that.
Well, I read your list, and probably the sensitive issues are anything relating to sex or sexual transmitted diseases or birth control planning. Have the parents accepted this as a role of the school?
Generally, no, at this point. I think this is why, again, we feel like that maybe they will accept the health department or the health nurse more readily than they will myself or, say, a teacher.
How will the program actually work there on the campus?
We come, I say we, the health nurse comes twice a month on Mondays for half a day. We make them available to the students. If through our counselor, through our teacher, through myself or whatever, if a child comes to us with a problem, we try to schedule them in to see Ms. McSwain.
So it's just a regular scheduled program?
Right, right.
We are not giving any actual care at the school. The only, quote, hands-on care of any kind would be the screening for weight, blood pressure, anemia, anything like that is strictly counseling, and trying to let the children know the services that are available, to plug them into a system, to let them know, you know, a lot of times they're worried and there's no reason to be worried, or yes, there is a reason to be worried when they're not, and to let them know that they have other choices, what healthier lifestyles are, what the consequences of risk are. Risk-taking, as we all know that came home last night in our community, is a very serious threat to our teenagers, and they don't realize. Dr. Todd, we should have done some statistics before we came, but she and I have been appalled recently at the number of young teenage girls, both black and white misconceptions, with high blood pressure in our family planning clinics that we monitor monthly, and we're talking pretty serious, that had no idea. Many of them, we can work with them, and with altering lifestyles, they never walk across the street, they eat only fried foods, junk foods, salt, and this type of thing, that we can get it under control and can still give them birth control pills if that's what they're there for. But it's amazing the number of young females that have really serious blood pressure problems, that are going to have some serious problems later on, right, Dr. Todd?
Yeah.
Well, you know, the three three food groups that Americans diet from constantly are salt, sugar, and grease. And the kids that I see coming in and out of my house love those three American food groups, but it does cause problems, doesn't it?
Really serious.
What about the problems that you see with the blood pressure? Is there also a cholesterol? Do you do cholesterol screening?
No, we don't have. That's another thing that we would like to get, but there's not money.
Well, these are related to diet. What do you do with a finicky teenager that won't eat? Dr. Todd, you've got one. Do you just take the vegetables and lock her in a room and say, this is it? You'll never eat again if you don't eat your broccoli?
We just, the nurses at the health department do a diet screening. They sit down and say, what did you eat yesterday? And they find out how many Cokes and potato chips and Snickers they had, and not a sign of a broccoli. And then they counsel them and tell them how important it is, and that's all we can do.
You know, one of the things that came to mind, do you find that you have some results with these children simply because you're not the parent, maybe on some of these
Many
instances,
times.
you know, from Buster or myself to our children, you know, oh, they're just telling us that, you know. But then sometimes when another person will come in with that same statement.
Yeah, a few, probably count them on one hand, but that Dr. Todd and Helen Calusa, the RN, and I have worked real closely with that were morbidly obese, that have gotten pretty well, you know, would lose like 50 to 75 pounds and get a blood pressure under control. And, you know, if it's only 5 out of 100, that's 5 that maybe we've saved some serious heart problems, cardiovascular problems down the road.
But that would be something simple that could be monitored there at the junior high, and the child wouldn't have to worry about getting a ride to the health department or pay for a private doctor's office visit. And that's what we hope to provide by this clinic that's school-based.
Now that was one of the things, the weight and blood pressure and anemia.
Yeah, anemia is another thing that's fairly common with our young teenagers that are the age they're on the junior high campus. And it's really usually simply corrected. And of course nobody wants their fingers stuck, but it's a really minor thing that a lot of times, you know, parents say, oh, they're chronically tired and blah, blah, blah. Sometimes there's a really reason for this. They are real anemic. We had a young child, maybe first grader, who was on some medicine to prevent TB, and his mom says, you know, he's just been so draggy and drugged down. And of course I immediately thought it was the TB medicine. The doctor said, let's do a hematocrit, and the child was anemic. Anything that simple that we don't usually think about in a well-fed society, and that you can look healthy and be anemic.
Happen. Before we go any further, let's have a word from our sponsor, Memorial Hospital, and then we'll be back with the coffee shop. We had that happen to us.
It's good to know that someone's there, a special friend with tender love and care.
Memorial Hospital, someone that really cares. Neighbors helping neighbors. When you're required admitted to a hospital, choose a hometown Memorial Hospital. Dependable, efficient, with personal attention.
Good to know that someone's there.
Our professional, efficient, friendly hospital staff cares about you. Our patients are special to our administration, management, doctors, nurses, and staff at Memorial Hospital. With emergency care, intensive care, Medicare and Medicaid approved. Neighbors helping neighbors. Memorial Hospital. We're there. and we care.
It's good to know that someone's there.
We're glad you're back with us, and we were just talking about some of the things that with Mary and Dr. Todd and our health education principal here, Jobe here. Is one of the things that is on the list is counseling for suicide. Have you encountered, there has been the scare for all of us, I think, with children with depression because of the other areas that have had this happen, just quite often that would happen, and it's the pressures that children are under in this day and time. I think that's an excellent program. Do you have any instances of seeing the need for that?
To get real honest for just a minute, we had 2 cases last year that we monitored very, very closely because we had picked up notes that the student wasn't writing to anybody, just writing to themselves just as a way of expressing things. And twice, very definite suicidal tendencies were noted at the junior high school. And of course, we counseled with our counselor there and also with the parent. They got professional help. Fortunately, they were of means and able to go get the professional help. Both students seem to be fine right now. But it's definitely a problem.
That's a crazy age you have down there. The emotions run in the halls, I think, don't they,
Right.
Lyndon?
Junior high is notorious for being one way one day the next. They're going through puberty, their little bodies are doing things they don't understand, and consequently they'll be like a baby one day and try to be an adult the next. And when this starts happening, they don't understand what's happening to them. And then they start comparing themselves to someone who maybe is a little more mature, and they don't understand why they're not that way, and it very often leads to depression.
I think that's, and you saying what you did about, getting with the parents when it's a very serious problem, I think the parents need to realize this is not something we're trying to take away from them.
Right.
It's just trying to help them in any way we can and be in this support where sometimes they will listen to someone else besides a parent when they're having a problem, and then taking it on for professional help, because if it's serious.
We have no intention of supplementing for the home with this program. I think that's where the students need to get it. They need to hear it at home. Unfortunately, we have students who don't. And
Well, one or two misconceptions that we probably ought to talk about a little bit. We were discussing before we went on the air the fact that one parent had sent the form back and said they wanted to know before you did operations or gave the children blood.
Right.
Maybe we should clear up what this program doesn't do. Are you going to have Dr. Todd over to operate on room 712's teacher's desk or anything?
No, this will be purely, at this point, a counseling type thing. We're not offering medication. If we see that medication is needed, we will refer them, be the parent, to the doctor or the clinic.
I'd like to add too that even though I counsel the children at the school, at that age with getting into the school and the permission slips as they are, we will not be conducting family planning clinics at the school. We will not be giving any kind of contraception at the school. If the child asks for the information, we will give them information and where they can seek help, but we will not be doing that at the school.
And there's no doctor at the school, it's just a nurse clinic.
And the form that you sent out, Mary, I had seen this and I had assumed that this is just the standard form that you have that I'm sure the attorneys have approved to be used, and that's why it would have to be sent with the school form, even though it lists a lot of things that you're not
That's
even going to
right.
be considering at the school.
The Attorney General's office, the lawyers there have made the general consent form for all state programs. We use that anytime anyone's seen in our clinic, plus there is a informed consent for each specific procedure that is done. That's why with the general consent having to be formed, we redid the letter this year. It lists the services, only the services that are available, and also suggests that the parents mark through what they don't want made available to their child or add something that they do, and they have been doing that. As Lyndon said, they've marked through some, added some, and some would like, I've had several calls from parents of junior high children that are already in the family planning clinic wanting to know, well, since you're out there and I've already brought them to clinic myself, can't they just get their pills there? No, they can't.
Let me interrupt here for just a minute. Some of the things that were added were things that we already cover through our school nurse program. I want to be sure that we understand this is not replacing any program that we have at school. We're not trying to get into our nurses' end of treating the little scraped knees or whatever, the eye testing, the hearing, these kind of things. We're not trying to involve ourselves in this end of the program. We're not trying to replace that program. We're just trying to add some things that we don't feel like our school nurse has the time for, number one. She's a very busy lady. And
well, she's only got 2,000 children. What does she
Right.
do up there? I mean,
Right.
with all her spare time.
Right. She just does not have time to do the counseling that we'd like to do with this program.
You know, Bill Haley's over here once a month, and he has touched on several times, Lyndon, the fact that the school is being put in a position of having to replace the parents and replace so many of our institutions that we depended on the family for and so
Right.
forth. Let's get tacky a minute. The anemia and some of the health problems you related to diet and exercise. I assume the school that takes on this role, because we have PE classes and we have free food in the cafeteria for certain groups of
Right.
people, or at least a nutritious meal.
Right.
But some years ago, Dr. Todd, we got the cigarette machines taken out of the hospital. It was a community push, and we got them taken out as a health hazard. Should we remove the Coke and chip machines in the school system? I realize this isn't your decision, but should that be done?
I have extremely mixed emotions about it. I think, from what I've seen in the past, if we don't have it there, they bring it. They're going to get the sugar, they're going to get the grease, they're going to get the 3 food groups you mentioned earlier. Either they're going to bring them from home or they'll buy them there. Unfortunately, we have students on our junior high campus that if it wasn't for the machines, would not eat at all. Now that sounds horrible, but they wouldn't. They, for one reason or another, they will not go to the cafeteria. And it's certainly not because the cafeteria food is bad.
Also, the children that are anemic aren't necessarily the ones that get the free food,
Right.
that have the
This is
health
actually-
problems. Many times more prone to be the ones that have the money for any snacks or to go anywhere they want to.
Right.
Are the ones with the unhealthiest habits. They're the ones that crack up their cars, that have them to do that. They're the ones that have the bad cholesterol if we had funds available to check it.
Affluence
Because they
has
have-
its problems, doesn't it?
That's right, it certainly does.
Well, I was appalled to find out that my kids were sometimes having potato chips and Cokes with the money I gave them. And of course, it's easy to say, well, if the machines weren't there, then they would have had to keep their money or have eaten something more nutritious that was in the cafeteria. And there's a certain group of people that believe eating nothing is better than eating Cokes and chips out of the machines. So that was my concern, and it may be, I assume it's going to continue to be debated.
This leads us back to our health thing. There again, is where we can get some good, sound, healthful advice and decision making.
Well, I've been surprised. I understand. I've been surprised when I see the materials that taught me how to eat. Like, I can still see that big chart on the schoolroom wall about the 4 food groups, and if maybe you had to have something of different color out of each group or something. Maybe I made a C+ in that one, but anyhow, the interesting thing was I never realized that the American Dairy Association put those things out. And it was self-serving on their part to get us all to drink milk. And we've got a nation that's grown up drinking milk, thinking that it really was the most healthy thing to do. And I assume that the fat content in milk is contributing to some of our health risk at a later age. So I think you're right. The nutritional aspects need to be carefully taught by people that are not biased.
Right. In defense of the students, though, we have this year just over 300 students on our campus. And I would think that we have 275 to 280 kids eating in our cafeteria every day.
That's good.
Either in
Either
the lunch line or what they call the snack line, where they can get a nutritional sandwich, get a little more choice here.
Well, I'm surprised about the ones that line up at the salad bar.
Oh, yes, yes.
You know, we have a salad bar out there now, and it's just amazing. You'd assume that they wouldn't eat, they'd never touch anything green, but they really do. They just, they line up at that salad bar.
Well, probably having the choice helps them to go and even eat just in the cafeteria line.
Right.
You know, it's just something about it. It's an adult decision. You know,
That's
I can
right.
do that instead of having to just go down the cafeteria line. I
think
have a
it is.
choice with the salad bar or the sandwiches or whatever.
I think the cafeteria has certainly helped their business by offering this second choice. And actually, they have 3 now. They have 2 choices on the lunch line, that those students who are on free or reduced lunch, they have a choice now. Before, they only had 1 choice. Now, they also have a choice. And then we have the pure snack line for just sandwiches and that kind of thing on the other side of the cafeteria.
And you're also serving breakfast, correct?
Right, right. We serve breakfast every morning.
In fact, that's at every cafeteria.
Yes.
That's very good, because a lot of the children would not have eaten when they got there that morning, so that helps.
I had one other question about the sex issue. We chose one campus to put this health information system into, and it was to cover your age group, which is?
7th and 8th grade.
7th and 8th grade. Now, they would be how old? About 13, 14?
12, 13, 14, basically.
Why this age group? Why did you go into junior high school?
I can.
Let Jane answer that.
Well, Texas is #1 in the United States for teenage pregnancies below 14. And you wonder how could that be, or why is that happening? With all the information available now, and all the scientific information that's in the United States, all available, but as far as practical information that gets to the kids, somehow they just don't get it. And so if we could provide knowledgeable nurses from outside the campus that could come on the campus, maybe students would feel safe coming to talk about very personal issues, very personal questions to someone outside the campus. They feel like their question would not be spread around campus. It would be kept just between 2 people, and then that child could receive accurate information about what they could do about whatever question they have.
Has the program actually begun? Or are you still in the process?
Yes. Last year we were on the campus. We didn't get geared up, I guess, around January, wasn't it, Lyndon? And I haven't seen that many individual counseling, but a few small groups. And there was one that, as we say, we're strictly confidential. The school does not know what they're talking to, that Lyndon did not know about, that was a potential suicide, that we talked to parents and got into counseling. So you can have 3 last year, unless it's one of yours, and we'll never know whether they were the same, but it doesn't matter, at least that we got help. Their word is beginning to get around about the strict confidentiality of the clinic and of us, and that we do not exchange information with the school nurse, not because we don't trust the school nurse, but because they need someone, as Lyndon says, outside the school that they can talk to. Like we tell our girls, we've had parents get really, really upset that come and sign for a young teenager to come to family planning. Then when there's something wrong with one of the tests, the mother is irate when I don't give her information. She can bring the child with her and get information, but that's that child's confidential medical information. The mom does not get access to that record. And as this word gets around and they realize that, yes, there is one person that they can trust, that maybe they will feel that they can talk to someone. And it's not that all of them want a method of birth control. They just need someone to talk to.
And of course, this is a state law that you do this. This is not something that you've made up for some reason or other. This is state law that you're required.
And at this age, everything is so important. What may seem insignificant or kind of funny or we may laugh about later to yourself as you're in your car going home. It's very important to that teenager at that time.
Well, our solution so far to drugs and teenage pregnancy is just say no. But I think in neither case has that program worked effectively. So I, for one, am ready to try something new, and I think education is probably it.
Well, we certainly hope so. Yeah. We're going to have a word from our sponsor, and then we'll come back in for just a minute. Let's have a word from Memorial Hospital, and then we'll be back and do a wrap-up.
A wrap-up.
It's good to know that someone's there, a special friend with tender love and care.
Memorial Hospital, someone that really cares. Neighbors helping neighbors. When you're required, admitted to a hospital, choose a hometown Memorial Hospital. Dependable, efficient, with personal attention.
Know that someone's there.
Our professional, efficient, friendly hospital staff cares about you. Our patients are special to our administration, management, doctors, nurses, and staff at Memorial Hospital. With emergency care, intensive care, Medicare and Medicaid approved. Neighbors helping neighbors. Memorial Hospital. We're there, and we care.
It's good to know that someone's there.
Get the job.
We're glad you came back, and Buster, I understand that Principal Jobe wanted you to stress something here as we close out, or maybe he would like to.
Well, I thought maybe he said it very well,
Okay.
Lyndon.
Well, the thing that you alluded to just before we broke, just say no won't work. They have to know why. And this is something that we as educators try to do, and it's another avenue through this program to give them the reasons to say no. Explain to them this is a poor decision and why. Because students, as opposed to years past, don't accept no without a reason. They have to know why they should say no.
Kind of like we used to say, but why, Daddy? And he
Right.
says, because I said so.
That's right.
They don't accept that anymore.
It does not work.
Well, we really appreciate y'all getting up here and sharing this with us, and we look forward to hearing from you again about the successes, because if y'all had 2 or maybe 3 suicide cases last year that you were able to point them to professional help, that was a success, tremendous success in that year.
Absolutely, and I would like to think that you could help prevent some teenage pregnancies, because that does affect a young person's life. In fact, more than one. Right. And we've got to find some way to help people get control of their lives in this respect. And good luck.
Thank you. We appreciate y'all coming, sure do. And we appreciate you filling in for Wayne while he's gone. Are you going to take you a month's vacation then?
He promised me I could go to Hawaii after he got back, but there's one other little problem I've got to solve before I can
thought
go.
he was going to take care of that too.
No.
But we're glad you joined us this morning for the coffee shop, and now if you'll stay tuned for the men's Bible class and afterwards for our church services. And Buster and I will be back next Sunday morning for the coffee shop.
Well, it's a great, great morning this morning. Consider since you tuned in the Coffee Shop Café. We've heard news around the town. It was told without a frown, cause the hosts were always smiling, saying, how do you do? It's been a great, great morning this morning. Consider since you tuned in the Coffee Shop Café. We're so glad that you were with us. We hope you never miss us at the coffee shop, the coffee shop, the Coffee Shop Café.
We want to thank our guests for contributing their time and efforts towards bringing you this program. And we invite you to be with us every Sunday morning at 9 o'clock for more information about what's going on in our community. The views and opinions of our guests are not necessarily those of First Baptist Church, KLCR Radio, or our sponsors. This has been a presentation of the First Baptist Church Media Ministries.
The Sunday morning First Baptist Church Coffee Shop has been brought to you by Memorial Hospital, who invite you to stay tuned for the First Baptist Church Sunday School radio broadcast.
my Savior.